marijuana, cannabis, weed, grass, whatever you call it, it is controversial. Off the cuff, where the headlines come to life, and my guests today are Miss Anqunette Jamison, former Fox 2 anchor. Welcome to Off the Cuff, and looking forward to hearing your story. We have Zahra Abbas, who is a patient and uses cannabis for her epilepsy, and we're going to talk to you about your story. And with us today is Dr. Gregory Barkley from Henry Ford Health System, who is someone who prescribes cannabis and also heads that particular department in regards to medical marijuana. So that's our conversation today. Doctor, welcome to Off the Cuff.
Thank you for inviting me.
Thank you for being here, all of you, and for being spokespersons for this concept of medical marijuana. But Dr. Barkley, talk to us about your position and how you felt this was something that you wanted to advocate for and also prescribe as a medication. What was your inspiration and what convinced you that this was the right thing?
Well, I think that one has to realize that marijuana has been used for more than 10,000 years
Absolutely.
for medication. And that when one talks to people with epilepsy, many patients for many years have said that they found benefit in the use of marijuana. The use of marijuana as a scientific product really is only in its infancy in the United States, and just in the past week, the first carefully controlled clinical trial was published in the New England Journal showing the benefit of a specific marijuana component, cannabidiol or CBD, in the treatment of people with untreatable epilepsy that was resistant to the standard medications.
Okay, so that's a scientific version of it.
Right.
And again, there's such a controversy in regards to social and recreational marijuana and medical marijuana. And of course, there's a movement to legalize basically both. So what is your take on that?
Well, I think there are a lot of myths. First of all, when people use marijuana for medicine, and I think that's a good way to look at it, you have to realize that for most people this is not smoky marijuana and it's not getting high. The components of marijuana that most people use for medicine are components that do not alter their awareness and provide relief from seizures or pain or various other symptoms that are used as a medication in a daily dosing the same way one would use blood pressure or other kinds of medication.
Zahra, now you are a patient of Dr. Barkley's, correct?
Sort of.
Sort of.
Dr. Zilka,
Okay.
who also works at Henry Ford Hospital.
Wonderful. But you do take medical marijuana for your epilepsy. So, and you were on regular medications before?
Still decreasing my medications, but I was on more than one medication for my epilepsy, and I have had a VNS surgery and brain surgery also before to treat my epilepsy, and was still having seizures daily.
So when you started the medical marijuana, was it like, wow, this is amazing? I mean, I'm not having these seizures. It's
Pretty
totally
much.
different.
Yes.
So instant kind of thing?
Yeah, it went. I used to have days where I stopped having seizures in between, sometimes a few days and things like that. So at first I thought it was okay, just
coincidence, maybe?
Coincidence, and then once it
Subsided.
kept going, I was like, something different is working. So it was like, okay, I guess this is really working.
So between the seizures that you would have, so how many days between or hours, or what was the frequency?
The most that I went without a seizure was a few months after brain surgery, and then on a regular time was probably, I think, maybe a week.
And then with the medical marijuana?
Longer than April 13, I reached 2 years seizure-free.
2 years
Oh my gosh.
seizure-free. Oh my, that's amazing. Oh, I just got goosebumps.
I know, oh my God,
okay.
it's teary. That's great.
You wanted to comment on that.
So when you use marijuana compounds like CBD on a daily basis, the medication is transformed into other metabolites, and some of these they accumulate over time, so that on the same dose it takes 3 or 4 weeks to get to a steady level in the bloodstream. So a gradual change in your symptoms are expected when using it on a daily basis for medication. So whether you're trying to treat seizures or migraine, headaches, or if you're treating pain, you will notice over time it becomes more effective at the same dose. So you gradually build up to the right dose, just like any other medication where you start at a low dose and you increase as needed.
I see. So it has to be very closely monitored as well. That's an amazing story. You also, well, we'll talk about that in a minute, but Anqunette, Q,
Yes.
affectionately known as Q. You were a Fox 2 anchor for a while, and your condition of muscular sclerosis, MS, sort of guided you to maybe take a seat back a little bit, but now you're an advocate for medical marijuana, and you know, again, there's so many different pros and cons to this. But what is your story? I mean, I know you had talked about medications being $70,000, and when I read that,
91 now. My one MS medication, Copaxone, which I was prescribed Copaxone, that's now $91,000 a year. For just that one drug, which is
just the one drug,
correct?
For yearly supply.
Yes, $91,000. But I was diagnosed with multiple sclerosis in 2013. I had fatigue, numbness, pain, and my feet would go to sleep, my hands would go to sleep. I fell in my kitchen one day, though. My legs just stopped working, and I face planted on my floor. I decided to leave my job, however, because my memory was the big thing for me. I have short-term memory loss, and it's because of multiple sclerosis. And since multiple sclerosis was affecting my memory so much to the point where I would forget what I was saying as I was saying it, and stress exacerbated that, and along with fatigue and muscle spasms and balance, a lot of issues that come with MS. So I decided that it was best to step away from my job, which was tough.
Sure, absolutely.
But that's okay, because now I have a new passion, and I'm just motivated by people like you and just these stories. We have to get the word out that this is medicine. And yes, you have some people who use it recreationally, okay, but for so many of us, this is vital that this be considered medicine, and that research opens up to us and regulation opens up to us, so we can make sure what we're taking, for our medicine, for our conditions. These conditions are life-altering and life-threatening, so this is important.
Absolutely. So what has been your experience in regards to maybe minimizing the pharmaceutical medications that you take and increasing the medical form of marijuana? What has been your experience?
At the height of my
phenomenal.
Thank you.
You look great.
At the height or at the worst of my condition, I was probably on about 8 to 9 different medications. By the time that you factor in a couple of muscle relaxants, something for the headache, something for the depression, something for the spasms, something for bladder urgency, here on up to 9 medications. I don't take anything anymore. I just take cannabis. I don't take any other pharmaceuticals. I've changed my diet, and I take cannabis, and I don't take any pharmaceutical. If it is a plant, I'll take it. If it came from a plant, I won't. So.
And you feel like?
I feel great. I feel great. I have bad days. I still have MS.
Sure.
And I know it's not cured. I know that cannabis hasn't cured my MS, but it's definitely treated my condition for the better. I take MRIs every year, and I've had no progression. And I've been off of my disease-modifying treatment for a year now. So, cannabis is my disease-modifying treatment.
Amazing. Dr. Barkley, I have my own, issues going back and forth in terms of medical marijuana, and until I really started researching this, I was like, absolutely not. It's mind altering. It affects your judgment. Kids are into this. It's ruining their lives. It's a gateway to other drugs. What do you say to people that? To me, I used to say that. What do you say to those individuals? Well, I know that marijuana, in terms of its medical form, is sort of treated where you don't have the THC in there, which is the mind-altering drug. Is that correct?
I do have THC. I use THC every day.
Okay.
So there are about 100 different cannabinoid compounds in marijuana plants. The 2 most famous are THC, which is the component of the recreational or party marijuana that makes you high.
Right.
And that binds to a specific receptor in the brain called the CB1 receptor. CBD or cannabidiol is the compound I mentioned earlier, which
Right.
is being tested in a scientific manner as a medication. It does not make you feel high. It doesn't bind to those receptors, and it works by a different mechanism. There are these almost 100 other ones that may have other medical benefits, and it may well be that in different combinations, one particular group of compounds will work better for one person or the next. I think it's fair to say that we're entering a whole decade's worth of research to find out what are the right cannabinoids for various conditions. It doesn't work for everything. It's not a panacea, but it does help in certain conditions. There are some cautions one has to take. Pregnant women shouldn't use marijuana because it can damage the fetus. That's pretty much a no-brainer. I think anybody would realize that.
Can I stop you for just 1 second? And I assume that was an assumption. And I know you're not supposed to, believe everything you hear on the internet. But there's a woman, and I actually wrote her name down, Melanie Draher, who actually did this entire research and advocates, which is really odd, advocates that when women actually smoke, and this is disclaimer, I mean, nobody should be doing this, but during pregnancy, and they followed children 5 years through that, and the children whose moms did smoke during pregnancy were more focused, were more socially active, and were more agile, and were able to have more muscle control than those that didn't. And so I found that a little bit hard to believe, but this is a woman who is a PhD and who goes around the world speaking about this. So and again, there you go with the the uneven conversation.
So I think it's fair to say that if one has a medical condition, that one always is trying to weigh the pluses and the minuses. I am involved with a second NIH research trial looking at the effects of standard anti-seizure medications on women who get pregnant and then have the children. We're following the children out for 5 years to see how they do on standard psychological tests to see if these drugs have effects on them. So there's a lot that we don't know, but we do know that if you give in research animals cannabinoids in the right combination, that you can actually alter their development in a negative way. So you can actually use cannabinoids and promote seizures depending on which cannabinoid and doses. So
Right.
I would say that as with any medication, if you're a pregnant woman, that you should be very cautious and work closely with your doctor for any medication during pregnancy. The other thing about cannabis is that we know from a lot of research over many years that THC, the mind-altering party marijuana component, has been shown in adolescents to alter memory and cognitive development in a variety of ways, and there's plenty of research that has looked at that for many years. Now, the most recent development of CBD as a drug being done in the traditional FDA approval process is testing for the cognitive effects of this. And so far the news, which is very preliminary at this point, looks promising. So I think that this is not a drug that one fools around with just to get high, because it can be dangerous. It can certainly affect your school performance and your development, and so teenagers shouldn't be smoking marijuana just to have fun.
Absolutely. So in regards to Q's situation and Zahra's situation now, they're not on the same combination of cannabis, are they?
Well, one size does not fit all. The company that is making the product that was just had the report in the New England Journal last week makes a product that's sold in Canada and Europe, which is a 50-50 mixture of THC and CBD that is sold in all these other countries for treatment of the spasticity associated with MS. So there's scientific research that supports that, and so Q's use of a THC CBD mixture is scientifically supported. Zahra uses a bit of THC because it works for her kind of epilepsy in addition to the CBD. So as I said, one has to realize that we're at the dawn of the scientific use of these products. And when you ask patients how they're using them, individual patients will sometimes use one kind of strain in the morning, a different at night, for a variety of reasons, because these products all have different effects on the body. And we are just starting to sort out the scientific nature of why what ratio works best, and the correct doses, and all kinds of questions that remain unanswered.
So, Q, do you go to a dispensary? A dispensary?
I do, and I also have, we're lucky that we live in Michigan where it's a caregiver system. So if you have a caregiver and you know someone who is really good at growing things and someone who would grow plants for you, which is what I do. So I have people grow plants for me, grow strains that work best for me, and that way I know where it's coming from. I know who's growing it, and it's my little stash, I guess. So I do it that way. I also cook with it. I incorporate cannabis into coconut oil usually, or another type of oil, and I cook with it. I make chocolates and I eat those. Like I have a little piece of chocolate before I go to bed at night because I deal with insomnia. So that's all I need to
sleep.
Right. I can take a pill or I can take a little piece of chocolate that I made in my kitchen, and I choose the chocolate.
So if you're growing it yourself, I mean, do you smoke it? Do you
A vape, actually. I think that
okay,
vaping.
the vaporizer. Okay.
When it comes to headache, I used to have daily headaches. I don't have them so much anymore, but headaches and stomach issues. My stomach is constantly upset with me for some reason. So I have found that 2 puffs off of my vaporizer, my headache is gone within seconds, and the stomach issues are gone within about a minute or so. It's amazing how quickly it works.
Amazing. And Zahra, how about you? What form do you take
Capsules for daily use.
So is it the oils?
Yeah, oil capsules. And then for the morning, I use a high CBD one. And then at night, it's a 1-to-1 strain.
1-to-1 meaning
THC to CBD.
Okay.
Yeah.
Dr. Barkley, so obviously with physical conditions, this is something that has been working. In terms of the mental health, situation regarding maybe bipolar, regarding depression, regarding ADHD, there's been a lot of conversation in regards to that. So what is your take? Is that something that people should investigate and sort of look further in regards to treating those things, or is that not an issue?
One should work with their doctor to try and find out what works best for them. But there is a scientific basis for the relaxation, the anti-anxiety effects, the mood stabilization of some of these cannabinoid components. And so if you have PTSD or certain mood disorders, you may find that this is a beneficial way to treat your disorder. But I would caution people who have mood disorders not to go off and try and find their own self-medication regimen, because a lot of the self-medication regimens may lead you into the spiral of progressive depression and bad decision making. So I think that if you have a mood disorder, you should be working with a doctor to try, or any medical condition where you're trying to use cannabis products to treat, you should be working with a doctor so that you don't get yourself into trouble.
But is it logical to go that route when you have those kinds of conditions?
I think it's logical to explore whether that class of medications may be helpful. I think if one wants to find scientific information, the government has a website called pubmed.gov, which is a shortcut to the National Library of Medicine, where all the scientific articles in the world have their abstracts published. And you can type in a condition, like you could type in cannabis and bipolar, and you will find reports of good and bad. You'll find that people may have had been bipolar who had used cannabis medication in an attempt to do overdoses, or you might find benefits. So that you'll find all the information that has been scientifically evaluated, and try and cut through some of the internet information which may have hype, may be true, may be distorted, one doesn't know. But when you use scientifically published information, you're more likely to get a balanced view, and you can print those out and bring the abstracts in and talk with your doctor about them.
Absolutely. I guess it's about educating ourselves too.
And our doctors sometimes.
Absolutely. Absolutely.
Without a doubt. And then it's also good when you are communicating with your doctor, and also talking with your dispensary to see which strain works, because there's also a lot of the strains that help one thing but might agitate another because of like the CBD THC ratio. And that's why I have like one that's high CBD in the morning and one that's a mix of CBD, like equal CBD to THC, because that helped my anxiety and depression at night, and it also helps me sleep.
So it is a scientifically based component. So it's sort of customized to each particular situation. Are we at that point?
Well, we're just starting to do the scientific work to find out exactly how to use this. I think one thing can think about the analogy to narcotics. The narcotics that come from the opium plant mimic products that are naturally released in our body called endorphins.
Mm-hmm.
And narcotics can be wonderful drugs that can relieve us from pain and be really make your quality of life much better when you've got a broken arm or something. But on the other hand, if you use narcotics wrong, it can be life-threatening.
Addictive.
And so I think the cannabinoid system is the same thing. It's part of the natural way the body works. We know that it's part of the reward system that gives you the so-called runner's high. It's what helps you relax after a good meal and feel pleasant. And so, like everything else, if you use the medication in a way that's correct, it will be beneficial. But if you don't use it in the correct way, it can be potentially harmful.
Absolutely, and this is like every other medication. If you use it the right way, it's a benefit. So I remember I had a hip injury and they gave me Vicodin. I took it literally one time, and I was crawling out of my skin, and it was like never again, ever again. Zahra, Hash Bash? Yeah, she went to Hash Bash. Not only went to Hash Bash, but actually gave a speech and spoke about the benefits of medical marijuana. So tell me about that.
Yeah, Hash Bash was like really amazing experience because you got to meet so many people over there that have stories, and it was just a really big crowd of people, and it was really great because everybody was smoking there.
It was great because everyone was
No,
smoking.
that wasn't the reason it was great, but it was got to meet so many people. Got to meet so many people, and Hash Bash was something that I've been wanting to attend for the past 3 years since I learned about it. And this year I got to attend it and speak there, and
it was an experience for you.
Yeah, it was an experience.
Good for you.
And thank you for speaking too, because
Absolutely.
people need to hear more stories from people like us, like you and me, and just, I'm glad you got to share your story. Yeah.
Q, now you're actually advocating for this in the legal sense in
Yes.
regards to medical marijuana. What have been your challenges in pursuing this on a legislative level?
Well, there's it's federally illegal.
Right,
That's the big one.
And that's the huge one. State, federal, that whole combination
which
is
I have
odd.
an issue with that, because our federal government on one hand tells you that this has no medicinal value, and on the other hand owns a patent for cannabis as a neuro. Yeah, more than one, really?
Right, sort of an oxymoron here.
Well, yeah, but the one that's most known is 6630507.
Right, yeah, which for the neuroprotectant, which is, come on.
Right.
Come on.
Yeah.
Some common sense in all of this.
And when I talked earlier about like educating physicians, it's obviously these are people who've dedicated huge portions of their lives to a medical training.
Sure.
But they don't learn about cannabis because it's federally illegal, and it's not necessarily studied in a university setting because it's federally illegal unless they want to get cannabis from University of Mississippi, which is very low potency. It's so I feel that with legalization would come an opening of research, for one, and also maybe a relaxation of myths and stereotypes. When I talk to other patients who are having a hard time talking to their doctors, because unfortunately they are not all like you, Dr. Barkley. They are not, and so many doctors are very hesitant to have their patients even try it. And so I tell people, go to PubMed, go to, just Google. I tell people all the time, just Google things. You will find clinical studies, you will find research things, even from other countries. And then print that out and take it to your doctor and just say, I just want to talk about it. This isn't working for me, but this has worked for some people for 10,000 years. Can we talk about this? I think that if we can get more people to be comfortable having a conversation with their doctors, that will help, and it would be helpful if it's federally, or at least in Michigan, legal, because that way people can feel a little more comfortable saying that I'm not suggesting that we, prescribe something that's illegal in the state, at least. If you can get it, tell me what I should and shouldn't do.
Absolutely.
Because we need our doctors to be partners, and we definitely don't need people going out and trying experimenting on their own.
Absolutely.
Yeah, the guidance is definitely helpful.
Q, you did say something in terms of the medical community. Dr. Barkley, what kind of pushback do you get in regards to the medical community and the acceptance of medical marijuana as a treatment?
I think the medical community reflects the population as a whole. There are some people who are strong proponents. There are some people who are adamantly against it, and other people are somewhere in between. And so each physician comes to his or her own idea about how they feel with terms of comfort. You really can't prescribe marijuana in Michigan. You can fill out a form that certifies that people have a condition that is listed on the checklist. But one doesn't even need that to get cannabis, because in the 2014 Farm Bill, there was a directive that allowed states to permit the production of hemp oil, which hemp is defined as a cannabis plant that has less than 0.3% THC in it. So you can buy cloth and rope made out of hemp plants. You can go to the grocery store and buy hemp seeds for their nutritional benefit that doesn't have cannabinoids in it. It has, omega fatty acids and things like that. Or you can buy CBD oils that are made from these kind of plants through the internet. Some providers are more reputable than others, just like anything else you buy on the internet. So there is in 31 states the ability to do this, and Michigan is one of those states.
So if I came to you, to your office and said, I'm having these issues and I really think this will help, how would you be able to, because I've never tried it before. I'd be the only one on the planet who hasn't.
No.
But I have not. And I'm very interested in the medicinal, effects of it. So if I were to come and say, okay, I have this issue and I'm a candidate for cannabis, so what would be the process of me being able to get it?
So as a physician, what I review with patients are, once we have settled on the diagnosis, we discuss treatment options. And my philosophy, it's your life, not my life. So my role is to educate you on what the possibilities are and let you decide which course you want to take with your options. And if I feel that a cannabis product is part of that, then I will discuss it. And if I think it's not a good choice, I will tell you that as well.
So how would I get it? I mean, you wouldn't give me a prescription.
No, but for example, if you were looking to get CBD, which is the non-intoxicating type of cannabinoid.
Right.
I have a list of CBD products that patients buy without a card that I know from patients telling me this is what they get, and you can also, I also advocate trying to make sure that the product they're getting has been tested at a reputable laboratory that tells you exactly what you're taking, because if you're treating this like medicine, you should do like any other medicine, is know exactly what you're taking.
Absolutely.
And how much is in that. So I really endorse trying to get the product you're taking tested or make sure it's been tested. And then we start at a low dose and build it up. If you want a mixture of THC and CBD, then you need to get the form filled out, which is a very simple form. It takes 5 minutes.
And then you get a card?
The card comes within 3 weeks.
Okay.
And then you go to a dispensary, and then you have a wide array of trying to figure out
Which
where to begin.
The dispensaries are like the Wild West.
They are.
So if you make the analogy between a liquor store and a dispensary, many liquor stores sell only cheap booze to people who are only interested in getting drunk. and some of the dispensaries are the same for cannabis. There are dispensaries that really focus highly on trying to make sure they have products of medical benefit, and those are the places that one should frequent. And right now there's not a lot of regulation. There have been some attempts by the state to try and bring a little bit more discipline to the dispensary process, and I think that, like anything else, it needs to be regulated. Because these are products that have potential for good and harm.
Absolutely, absolutely. Well, the conversation is certainly a valuable one to have and to continue having. So I hope you'll come back maybe when things change a little bit and discuss. Thank you so much, Q, for being here. Zahra, thank you. Keep making those speeches at Hashbat. Yes. Dr. Barkley, thank you for everything that you're doing and creating awareness and wonderful spokespeople for this kind of thing. Of course, not advocating marijuana in any way, shape, or form for any kind of recreational use, but educating ourselves as to its properties and how it can be medically conducive for communities rather than using the pharmaceutical drugs. Have a good day. Thanks for joining us on Off the Cuff.